Resolving our needs in mental health nursing. Ethically challenging situations are commonplace in nursing. As nurses, we encounter these situations in our workplace. How we challenge these situations and speak up that can change the course of action. Beauchamp and Childress' 2013 principle-based ethics framework are taught and used in nursing practice, with the 4 principles proposed: autonomy, beneficence, non-maleficence, and justice. It is these principles which we encounter in our practice. The Code of Ethics for Nurses in Australia, developed by the Nursing and Midwifery Council, outlining the nursing profession's commitment to respect, promote, protect and uphold the fundamental rights of people who are both the recipients and providers of nursing and healthcare, is relevant in all areas of nursing, including mental health. Nurses have a responsibility to promote the Code of Ethics in their nursing care. In the case study, we are presented with an ethical dilemma which becomes apparent from a medical review. An ethical dilemma is a situation arising when equally compelling ethical reasons both for and against a particular course of action are recognised and a decision has to be made. The dilemma which presented itself to the writer is from a young Aboriginal man, Warren, who has his own beliefs in his treatment for his mental health illness versus medication. Health for Indigenous people is viewed within a holistic and community lifestyle framework, with Indigenous culture, health beliefs and treatments being seen as traditionally belonging to either an Aboriginal or biomedical system, which are considered to be conflicting, yet it has been proven both systems can be used simultaneously. On the day of presentation, Warren arrived stating he felt there was no need to take the medication prescribed anymore, olanzapine and lorazepam. This medication had been working well for Warren, where he was able to control his thoughts. Although for long-term treatment medication adherence is preferred, it is necessary to respect a person's autonomy. We spoke with Warren about his treatment, in which he engaged, speaking about his values and beliefs regarding his illness and what the meaning of recovery meant for him. During the conversation, it became clear that Warren was not willing to engage in further treatment. A dilemma was arising between the patient's autonomy and the ethical principle of beneficence. Capacity and consent are one of the biggest issues faced by mental health workers, where there are overlapping moral and legal obligations. We faced an ethical dilemma of facilitating treatment adherence or forcing treatment compliance. Treating teams aim to provide the least restrictive method, making assessment and planning important, and decisions made along with mental health staff must ensure a practice which is supportive rather than being coercive. Healthcare practitioners have a legal, ethical and professional obligation to obtain patient consent for all treatments. In mental health care, the concept of coercion is widely used and is considered relevant to consent to care and treatment. Coercion can cause damage to a person's autonomy and self-respect. If the harm is more than any benefits provided by the coercion, then the coercion is unjustified. We should consider what is most beneficial for the client and not automatically assume that any benefit justifies a coercive action. Coercive practice does happen and can only happen if a patient lacks capacity to agree and a decision needs to be made what is in the patient's best interest, considering if there is any risk to themselves or others. Can coercion be ethically right in clients who have limited capacity to fully understand the consequences? Research shows that even in these cases of incompetence, coercion is not justified. Authors have suggested using slight coercion can be beneficial to the client, while it is well documented that having a therapeutic relationship, one the client can trust, and respecting clients' decisions to enable a person to develop self-esteem and decision-making abilities are far more beneficial. Through ethical reasoning, decision-making and implementation of decisions, the treating team could come to a decision. It was identified Warren would not pose a threat to society if he was to become unwell. Warren had been in the service for over a year and had been making good progress, but had setbacks and when unwell becomes paranoid but not threatening to others. In making this decision, the team must be able to identify moral issues and distinguish them from legal issues, while being able to assess the impact and consequences that the action will have on the client and his family. In society today, mental illness and violence are often seen as linked, creating a harsh stigma for patients. Acknowledging and being respectful of Warren's beliefs, enabling him to maintain autonomy, is vital, but it is also important to provide an understanding to him that by not taking his medication may potentially lead to a relapse in his mental state. It was important to consider Warren's culture and work within a culturally appropriate procedural framework. As a service provider, we do not only want to respect Warren's choice for recovery, but also support him in his decision-making, and ultimately the decision will be his. It is always our role to provide supportive practice rather than coercive practice. Shared decision-making is important, and the nurse should empower the client to make good choices in their health care. There will always be conflict between ethical values and interventions that are implemented. To control and help are often interrelated, especially in psychiatric nursing, and the implementation of restrictions always include a misuse of power and perceived punishment, even if the express purpose is good. Ethical decision-making should be made on a case-to-case basis. There is no one decision is practical for all. To be ethically competent, the author and the treating team have identified the least restrictive methods, identified the issue, considered all who was involved, used a framework where relevant information was gathered, formulated an action, made a decision, implemented that decision, and reflected on the practice. During the assessment, Warren's medical, social, legal, and interpersonal circumstances influencing his present state was taken into consideration, and our own values had to be managed. Ethical decisions are embedded in day-to-day practice, and reflecting on ethical considerations in your daily practice can provide a base for more ethically informed practice.